Hi, my name is Shigone. I'm going to be a student nurse today. I'm going to perform a head-to-toe assessment on you today. I'm just going to ask, do you have any pain right now? No. All right. And do you use any assistive devices? No. All right. And I'm just going to show, I have my stethoscope for the assessment. I have my gloves, I have my pen light, and I have my hand sanitizer for hand hygiene. All right. So I'm just going to have you tell me your name.
My name is Tani Kim.
All right, and what time is it?
Time?
Sorry, what day is it?
Today's 21st.
Okay, and where are we?
In the library.
All right, so patient's speech is clear, and patient is alert and orientated ×3. I'm just going to start off by assessing your overall appearance. Patient is dressed appropriately for the weather. Patient has no sign of pallor or cyanosis. Patient's skin tone is appropriate to patient's background. I'm going to just start by assessing your hair, okay? I'm just going to put on my gloves. Well, I'm going to perform hand hygiene before I put on my gloves. All right? So overall, the head looks like it is midline to the body in appropriate position on the body. All right, I'm just going to palpate the hair. All right, so patient has no signs of any dandruff. The hair is evenly distributed throughout the head. There's no lice at all, and the patient's hair color is appropriate. And also, the scalp is appropriate moisture for the hair, okay? So now I'm just going to start by looking at your eyes, okay? So patient's patient's iris is brown, patient's sclera is white, there's no drainage coming out from your eyes. You're going to just pull down on the underneath of your eyes to check your conjunctiva, okay? Alright, so patient's conjunctiva is pink and moist. There's no signs of drainage in that as well. The patient's cornea is clear, alright? So now I'm just going to use a pen light, and I'm going to just check your pupils, okay? So can I just have you look straight into the light? And we'll do your other eye. Alright, so patient's pupils are equal, round, and reactive to light, and it accommodates to light as well. I'm just now going to assess your your 6 cardinal field gaze, okay? So I'm just going to have you look at my pen light, and you're going to follow it to where I put it, okay? Alright, so patient's eye muscles are intact. The patient was able to respond to the 6 cardinal fields of gaze. I'm now just going to test your peripheral vision, okay? So let me know when you do see my hands come up. Alright, so patient's peripheral vision is intact. I'm just going to have you remember 3 words that I'm going to repeat to you at the end of the exam, okay? Dog, board, and picture. Alright? So now I'm just going to assess your nose. Alright? So patient's nose is midline to the face. There is no lesions or any rashes or redness on the nose. I'm just going to have you put your finger to one nostril and breathe in, breathe out, and you're going to do it to the other nostril. Alright, so patient's nostrils are patent. Seems like there's no signs of any obstruction. I'm now going to look into your nostrils. Can I just have you lift up your nostrils? Alright. Alright, and there's no drainage in the nostrils. Patient's septum is not deviated, and it looks like there's no nasal obstruction. Right? So now I'm just going to take a look at your ears. Do you have any problems hearing at all? And do you have any vision problems? No. Alright, and you don't have any problems with your smell? No. Okay, so I'm just going to look at the external ear. Alright, so the external ear is warm to the touch and dry. It's appropriate color. There's no lesions or nodules on it. I'm just going to take a look into your ear for a moment. Alright, and patient has no excessive wax in the ear. There's no obstruction. The patient's airway is clear. I'm just going to whisper a word into your ear. You're going to let me know what you hear, okay?
Animal.
Ouch. Alright. Patient passed the whisper test. Patient's hearing is intact. I'm just going to take a look at your lips. Patient's lips are pink, moist, no signs of any cracked lips. There's no dryness going on. I'm just going to have you open up your mouth and say ah. I'm just going to take a look into your mouth for a moment. All right. And you're going to put your tongue up. All right. So patient's teeth are white. Patient has, I can answer the patient's tonsils +1. The patient's uvula is midline and symmetrical. It goes up symmetrically when the patient says ah. There's no signs of bleeding in the gum, no swelling. The mucous membranes are pink and moist, and there's no excessive saliva or any drainage from the mouth. Okay. I'm now just going to have you swallow, and I'm going to just take a look at your. I'm going to palpate for your thyroid. Okay. All right. Patient's thyroid was unable to be palpated, meaning the patient does not have an enlarged thyroid. I'm now just going to have you, I'm just going to check for your accessory muscles. So can I just have you puff out your cheeks, frown, lift up your eyebrows, smile, and lift your shoulders up. All right, so it looks like patient's cranial muscles are intact. All right, so I'm just going to now check your sinuses. Let me know if you feel any pain or pressure as I do this, okay? I'm going to start with the frontal sinus. Any pain at all? And now I'm going to palpate the maxillary sinus. No? All right. So patient's has no tenderness or any soreness in the sinuses. Patient's face was warm to the touch when I touched her skin. So now I'm just going to feel for your trachea. Okay. Patient's trachea is midline to the body. Patient's neck is midline to the body and erect. All right. Alright, and I didn't feel any bumps at all as I palpated the trachea. Alright, so now I'm just going to assess your skin turner, okay? Alright, so patient has proper hydration going on. The skin turner showed no signs of tenting. The patient had rebounding of the skin turner. Her skin is warm to the touch and dry and appropriate color for her skin tone. I'm just going to check your nails. The nails are not cracked or have any excessive lines. The nails are pink. I'm just going to check for your capillary refill, okay? Alright, patient's capillary refill is under 3 seconds, showing appropriate tissue perfusion. I'm just going to test the range of motion in your arms, okay? Can I just have you circumduct your right arm? I'm going to have you rotate your wrist, and I'm going to have you flex your elbow. All right, any pain at all? No. All right, there's no crepitus in the right hand arm joint. I'm going to do the same thing on your left. You're going to rotate your arm, you're going to rotate your wrist, and then you're going to flex your elbow. Any pain at all? No. All right, and there's no crepitus in the left arm. I'm going to now test the strength of your right arm. Can I just have you push up against my hand, push down against my hand? All right. And patient's arm is strong. The range of motion is strong and a 5 out of 5. And I'm going to test it on your left arm. You're going to push up against my hand. You're going to push down against my hand. All right. So patient's left arm is also strong and it's a 5 out of 5. I'm just going to now check your range of motion in your neck. Okay. Can I just have you lift your neck up, your head up, put it down to your chin, and lay your head on your right shoulder, and then your left shoulder. All right, I'm going to put my hand against your neck. You're going to push against me, your head. Okay. All right, and I'm going to now just test for TMJ. So I'm just going to feel the TMJ. Tell me if you feel any pain, and you're going to open up your mouth, close it. All right. There is no crepitus at all or any pain. And no pain in the TMJ. All right. So now I'm just going to assess. I'm going to assess the strength, range of motion in your lower extremities. Okay. All right. So we're just going to push your leg up against my arm, push it down, up, down, and you can push this upper leg up against my arm. All right. Patient has range of motion. Patient's lower extremities are strong and a 5 out of 5. All right. So now I'm just going to have you. I'm going to test your fine motor skills. So can I just have you touch your fingers, your thumb to each finger? All right. Patient's fine motor skills are intact. I'm just going to now touch 5 parts of your body. Please let me know what parts I'm touching. Okay.
Right shoulder, left thigh, right hand, right calf, left feet.
All right. Patient is able to sense where I touch, so patient's sensation is intact. I'm just going to have you stand up for a moment, please. And I'm going to just test the range of motion in your lower extremities. Can I just have you abduct your leg, your right leg? And I'm going to have you now flex it, your right leg. All right. And I'm going to have you do the same to your left leg. Abduct. Bring it back up and flex. All right. So there's no signs of, there's no crepitus at all. Is there any pain? All right. So now I'm just going to have you lift up. You're going to check your balance. I'm going to have you lift up your right leg. All right, and lift up your left leg. Patient's balance is intact. There was no swaying as the patient lifted up the right and left leg. I'm now going to have you close your eyes and put your hand in front of you. Okay. And you're going to put it back down. All right. Patient has no sign of unbalance. The patient's not unbalanced. Patient is able to pass a Romberg's test. And now I'm just going to assess your gait. I'm just have you walk straight ahead and back towards me. All right, so patient's gait is appropriate. There is no dragging of the feet. The patient's posture is erect, and the patient's gross motor skills are also intact, okay? So while you're standing, I'm just going to assess your back. Can I just have you turn around for me, please? I'm just going to assess your spine. Can I have you bend forward? I'm going to palpate the spine. All right, you can get back up. Patient's spine is straight and no signs of any lesions or any bumps at all. The patient has no signs of scoliosis or crepitus. There's no signs of any lordosis or kyphosis. All right, so now I'm just going to put my thumbs on your lungs and chest, check your chest expansion, okay? Can I just have you breathe in and breathe out? All right. Patient's chest is able to expand appropriately. My thumbs moved away symmetrically when the patient inhales and exhales. I'm just now going to check for your lung sounds. All right. So I'm just going to have you inhale and exhale for me, please. Starting on the right side. Inhale, exhale. We're going to inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. All right. There were no signs of any adventitious sounds. There was no wheezing as the patient was breathing. I'm now going to check the anterior part of your lung sounds, okay? I'm going to have you breathe in and breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. All right, patient's anterior lungs also show no signs of wheezing or any adventitious sounds. It's normal bronchobascular sounds, okay? I'm now going to just assess the general precordium. It looks like the chest is appropriate. There's no barrel chest at all. The patient is breathing normally with no problems. I'm now just going to assess the heart sounds, okay? All right, so I'm going to start off with the aortic intercostal space on the right side. And now I'm going to move to the pulmonic intercostal space. Erb's point, tricuspid valve, and the mitral valve. And now I'm just going to listen for the S1 and S2 sounds starting at the fifth valve. Right, patients S1 and S2 valves are present and able to be heard bilaterally. When I check the patient's heart, the heart rate is normal, no murmurs at all or galloping. All right, so now I'm just going to have you lay down. I'm going to check your abdomen, okay? All right, so I'm just going to listen for vowel sounds in the abdomen. Starting from the right upper quadrant. quadrants. Now I'm going to check for the vascular sounds. Alright, so I was able to hear the patient's bowel sounds, and there was no more gurgling. I was not able to hear vascular sounds, which means there are no signs of any masses in the abdomen. I'm now going to palpate the abdomen for any masses at all. Alright, so the patient's abdomen has no masses or any lesions or any rashes. There's no striae. The skin was warm to the touch and cool. There's no signs of any redness or any pallor at all. Okay. So now while you're down, I'm just going to assess your capillary refill in your toe. Okay. All right. So patient's capillary refill on the lower extremity was under 3 seconds. I'm now going to check the skin turgor. All right, patient's skin turgor showed no signs of tenting and rebounding. The patient's skin is warm to the touch and dry. There's no signs of any rashes or any lesions on the skin. I'm just going to now check the posterior tibialis pulse. Okay, I'm going to check both of them. All right, so the posterior tibialis pulse are 2+, bilaterally and equal. I was able to feel both of them. I'm now going to feel for your dorsalis pedis pulses. All right, and the dorsalis pedis pulses were also 2+ bilaterally and equal. I'm just going to have you sit back up for me, please. I'm going to check your radial pulses, please. Thank you. All right, patient's radial pulses were equal bilaterally, 2+ as well. I'm going to now check your carotid arteries, okay? All right, so patient's carotid arteries were both bilaterally equal and 2+ as well. I'm just going to now listen to the carotid arteries, okay? Alright, I do not hear any roots when I listen to the patient's carotid arteries. I'm just going to now have you repeat the 3 words I told you at the beginning of the assessment.
Picture dog.
Okay, patient's short-term memory is also intact. Thank you very much, okay?